Hi, I'm Alicia Mahoney with BCMS, and today I will be doing a quick demo of our compliance program for outpatient rehabilitation clinics. Our program covers all regulations that are mandated by the Department of Health and Human Services, including HIPAA, Medicare, Medicare Advantage, fraud and abuse, and non-discrimination. It also covers all the Department of Labor requirements, including OSHA, bloodborne pathogens and hazard communication standards, the Office of Civil Rights, Equal Employment Opportunity Commission, and the ADA, Americans with Disability Acts. Would you know what to do or how to prevent an employee from accidentally handing the wrong insurance card back to an incoming patient during a busy intake? Did you know that this is a reportable HIPAA violation? Would you know what to do if Mr. Smith was on blood thinners and was on the stationary bike, and when he was getting off the bike, the pedal slammed into his shin and he started to bleed? Would you know how to properly clean and dispose of the soiled cloths according to healthcare regulations and OSHA requirements? Would you know how to properly document the incident? Did you know that when it comes to patients who do not speak English, you are required to provide translated taglines and an interpreter at your cost if requested? Did you know that as of October 1st, 2016, you are supposed to have a non-discrimination posting in the waiting area indicating your understanding of the Affordable Care Act and compliance of Section 1557? If you answered no to any or all of these, that's okay. That's what BCMS is here for. Right here is our compliance resource portal, and this is where our clients house their compliance program. We're going to start by showing you some of its features. First and foremost, we're going to license you to about 240 forms. You would never use all of those. Typically, most of our clients use about 30, but this includes everything from your HIPAA privacy notice, your job descriptions, your personnel file forms, your incident reports, intake forms, all of those that you can go through, and there will be resources, education, and a lot of tools. We're also going to provide you with state-specific resources. These are going to be typically based upon human resources or HIPAA-related incidents. We're going to then have your very own compliance program silo where your program will be housed. This is going to cover 6 policy manuals, not just the kind that you see in binders that get dust, but these are going to be in the cloud so that you can see them from any tablet, phone, or any desktop. You'll also have a downloadable version if you do prefer to print out. We're going to cover all the requirements within your business office manual, your clinical operations, environment, health, and safety, HIPAA, human resources, and of course your employee handbook. We're also going to have all of your fully scribed procedures and modalities for you to choose from based upon your clinic's needs and what you do. Inside of each of these manuals, you're going to see they are fully scribed policies and procedures, not an outline or a template. We're also going to hyperlink any of the forms that we suggest you utilize inside of there so you're able to see them. Some of the tools that we use inside of the program to help you get through it are going to be tools like this one, which is a compliance calendar. This is something that we use to help you break down what you should be doing throughout the year for compliance for all of the regulations we discussed. These are going to be bite-sized pieces, so replacing the battery in the smoke detector, getting the fire marshal out there, doing your biannual clinical record audits, etc. So we're going to have these in user-friendly tools so that you aren't feeling overwhelmed and you're going to have bite-sized pieces to help you get through these things. The way that you're actually going to get these customized manuals into place is actually pretty easy. We're going to send you an email. Again, everything we do is cloud-based. So you're going to get an email that looks like this with step-by-step instructions and training videos for each step. The crux of the program is step 4. This is going to be where you can get those customized policies and procedures. You're going to be able to come into these questionnaires and start to fill out your questionnaire based upon your clinic's name, and then you'll simply date and start to answer the questions. Whenever you use a checkbox, it's going to open up industry standard language. Most of the time you won't need to do any editing at all, just check the boxes. But when you do, we're going to specify please customize. So you would be able to come in here and specify and customize based upon paper or electronic system or how you guys do your typical intake scheduling. Same thing goes for another policy here, how you would customize within the box. If you were to do no charges, no shows or cancellations, you would want to come in here and just modify this based upon what you guys do. Once you're done with the actual customizing of the questionnaires, you will simply hit submit and your fully scribed policy and procedure manuals will come to fruition. And then you can start things like your orientation and staff education. Your orientation is going to be something that we provide so that you don't have to go and make sure that the staff is reading every single thing. The goal of the orientation is for you to make sure your staff knows where the policies are and they understand what applies to their job and how to review them. So we provide you with these simple tools, things like this, where they've got a key and they know that these are the policies that they should review from your business office manual. They can initial next to these and hand these back. And now you've got full documentation of orientations. Okay, so in addition to your compliance program, once you have those in place, we have attestation forms, which are right here. Your attestation forms are tools used as you start to make modifications so that you have documentation annually or biannually, depending upon how often you change policies, or we provide updates for you so that your staff knows where those updates are. No longer will they have to review everything every single time you make a change. You're only going to show them what needs to be changed and what was changed. So the other things that we have inside of here are easy tools like this to go along with that compliance calendar. We're going to send out a monthly email that looks like this that says, hey, here's what you're supposed to be doing, and here's the resources that we have to help you get through these step-by-step bite-sized pieces that were part of that compliance calendar. This is just our email reminder to help make sure you're seeing these things and you're able to get through them. So this is our compliance program. It's very user-friendly. We have other services and things like our human resources program. We have our onboarding and education silo that really walks you through step-by-step on how to go through and make sure your staff is fully educated and you're not missing anything from a human resources standpoint or any of the requirements from a healthcare provider. We have webinars that are fully educational, but all of these resources are going to be easily accessible based upon the subscription that you purchase with us, and we're going to be here to hold your hand through the whole process. You won't have to worry about needing to set up a help desk tag or anything to that extent. You'll be able to easily get onto my calendar or a phone call, and you're going to reach a live person who's going to help you. So that's our demo today. I hope that this gave you enough information. If you would like more, please feel free to email or call me, Alicia Mahoney, 713-899-9812, and we look forward to serving you and all of your compliance needs. Thank you so much.